So now in this part, we'll look at gestational diabetes. Now, gestational diabetes is glucose intolerance or accumulation of glucose that is first recognized during pregnancy. So that means before the woman becomes pregnant, she is not diabetic, and then as soon as she gets when in pregnancy, diabetes is diagnosed. That is known as gestational diabetes. Now, gestational diabetes can occur during pregnancy as a result of insulin resistance or maybe a reduction in insulin production. Now, insulin resistance, as in insulin is available, but the cells of the individual is not responding to the action of insulin. So glucose is not being driven into the cell, glucose accumulates in the extracellular space. Then also reduce production of insulin. Now this one can occur or affect between 3 to 9% of pregnant women, and it mostly occurs during third trimester of pregnancy. Now, this can occur as a result of back and forth of hormonal activity here and there. Hormone production and synthesis are mainly triggered by negative or positive feedback mechanisms. So, if they are because there are different hormones rising at the same time, stimulating different actions and causing different effects at the same time, there can be maybe a negative feedback, sustained negative feedback to the pancreas, and that can affect the production of insulin in pregnancy. And so this one can result in gestational diabetes. Now, there are certain factors that are common in pregnancy that can predispose a woman to developing gestational diabetes mellitus, and they include hormonal changes. Now, you know that in pregnancy, there are various hormones that are coming up, and there's back and forth here and there of different hormones, one hormone countering the other, one hormone facilitating the other, and all that. That can push the effect of insulin production and reduce it, and it can result in gestational diabetes. Then another factor is weight gain and obesity. Maybe in pregnancy, women the cravings of women change in pregnancy, and so because of change in the cravings, it can affect the manner in which the woman eats. Now, she could eat and gain weight to the point that she becomes obese, and obesity on its own has its own impact on insulin, functioning of insulin. Another thing too that can predispose a woman to developing gestational diabetes is a previous history of gestational diabetes. Maybe in her previous pregnancy, if it's someone that was pregnant before, in her previous pregnancy, she had gestational diabetes, and so after the pregnancy, maybe after delivery, after some months, her condition reversed to normal. Now, in another pregnancy, the chances that she will develop gestational diabetes is high because she has had a history of it, gestational diabetes. And another factor too that can predispose a woman of coming down with gestational diabetes is a familiar history of diabetes mellitus. Maybe in her family, parent, relatives, grandparent, foreparent are diabetic, or they have diabetes in their lineage. Even though she didn't manifest before pregnancy, she can manifest it in pregnancy, and then resulting in gestational diabetes. And then also polycystic ovarian syndrome. A woman who is having polycystic ovarian syndrome and then gets pregnant by chance, and before you know it, she could come down with gestational diabetes mellitus as well, because polycystic ovarian syndrome causes insulin resistance. Now, also, gestational diabetes, when it occurs, increases the risk of a woman developing preeclampsia. It increases risk of developing preeclampsia. It increases depression. It can throw her into depression, and also it increases her chances of giving birth to her baby through cesarean section. So these are what gestational diabetes can cause in a woman. Now, most times, gestational diabetes resolves after delivery, few weeks to few months after the woman has had her baby. However, the risk of developing type 2 diabetes following gestational diabetes is high, both for the mother and for the child. So the likelihood that a woman who is having gestational diabetes can come down from there, continue as type 2 diabetes is there. The likelihood that the baby will likely develop will develop diabetes mellitus in future is also there. Now, it should be noted that gestational diabetes can be easily managed by a controlled meal plan when it has been, as soon as it's discovered or is diagnosed, the woman is placed. That's the significance of having a nutritionist in a hospital setting, so that the woman is placed on a meal plan where certain things will be added to her diet and certain things will be removed from her diet as well. And also engagement in physical activities, that are exercises that are suitable for pregnant women. There are, you see, some pregnant women still go to the gym to do some mild exercises. So there are exercises that can also be used to control the glucose. And then also, where meal planning and exercise, where the physician or the gynecologist observes that meal plan and exercise or physical activity may not be able to bring down or control the glucose level significantly, then certain medications can be introduced to manage glucose in order to help the mother live well in pregnancy and also to reduce the risk of um, accumulation of glucose on the fetus itself. So that's that for gestational diabetes mellitus. Now, we can also look at, briefly touch other types of diabetes mellitus. We have talked about type 1 in the previous video. We talked about type 2 in the previous video. I think it's good to talk about other things too that can cause diabetes mellitus too, that may not be classified on their own, but can cause diabetes mellitus. Now, the first one we'll talk about is the maturity onset diabetes of the young. It's known as MODY, MODY. Now, MODY is a kind of diabetes mellitus that occur among young adults, and it is caused by a mutation in a gene, mutation in a single gene in that individual. It can result in maturity onset diabetes of the young. And then there's also one that is known as neonatal diabetes. Now, these ones are genetic factors as a result of mutation in gene. So they are associated with the gene. Um, and so, as a result of that, there is um, a there's an impact on the functioning of the pancreas. And so because of that, it can result in accumulation of glucose in the body. Now, there are also other causes like the disease of the pancreas, maybe a damage to the pancreas, maybe like in pancreatitis, which is an infection of the pancreas, or maybe the cancer of the pancreas, or maybe somebody who is suffering from cystic fibrosis, or maybe somebody who has had pancreatic surgery in the past. Now, all these ones put together are collectively known as the disease of the endocrine pancreas. I said these are occurring from direct effect on the pancreas, like infection, like surgery, like cancer or cystic fibrosis. Now, there are certain other causes too that can affect pancreatic function. For example, certain medication. Maybe somebody is on treatment for another purpose entirely, but that's one part of the side effect of that medication or of those medication is impacting on the functioning of the pancreas. For example, HIV medications, For example, antipsychotic drugs or some other kind of medications also, they can affect the functioning of the kidney, sorry, the functioning of the pancreas, and it will result in diabetes mellitus. Thank you.